Okay, so where are we with ADHD in Poland? Let me introduce myself from the point of view of ADHD. I'm a psychiatrist. I specialize in ADHD. I am a medical director of ADHD clinic called ALMA, and I have around 2,000 patients under my supervision, aged from 3 to 6 years old. As we know, the number or prevalence of ADHD rises everywhere, practically everywhere, all over the world. And unfortunately, not in Poland. Well, it's also rising in Poland, but you'll see how. So there was a study 2 years ago, Norwegian study. That's why you see Norway here, divided into regions. But we are interested in this map of Europe, and the brighter the color, the less ADHD there is in the country. And as you can see, Poland and Romania are the two countries with the least prevalence of ADHD. Thanks to the data that I received from the Polish register, it is true that this is the number of people with ADHD in Poland. Sorry, it's in Polish. And as you can see, the number is rising, it's true, throughout those 7 years. But 72,000 people with ADHD in a country of 37 million is around 0.2%. So this is currently the prevalence of ADHD in Poland. You could say ADHD nearly does not exist in Poland. I mean, which is a very, very rare disease. We talked with Professor Chang about that pediatricians should treat ADHD. And when I talk to pediatricians in Poland, they say that ADHD is overdiagnosed in Poland. Really. Many pediatricians say that, that ADHD is overdiagnosed in Poland. And they don't want to diagnose ADHD because it's already overdiagnosed. So what's the problem? Where are we? Why is ADHD not diagnosed in Poland? There are several reasons. So the first one is low ADHD awareness among physicians and psychologists. And for this reason, they often refuse to diagnose this disorder. Patients come to me and say that they were sent by another psychiatrist who doesn't know anything about ADHD, so he does not want to get involved, and you should go to another doctor. Another group come after several even visits to some specialists like psychiatrists or psychologists, and they had said that ADHD does not exist, so they will not diagnose, and the patient can do what they want, but certainly there's no such thing as ADHD. Also, very often people say, since I got a bachelor degree, this means I can't have ADHD. It doesn't matter that I couldn't finish any of the 4 graduate courses that I started. I graduated from bachelor degree, and that's it. This means that this is what psychologists tell them. And so they believe that probably they don't have ADHD. Another problem is improper diagnosis. So the low awareness leads to improper diagnosis. Patients are often offered various diagnostic methods that are not justified and are not needed or do not contribute anything to making the diagnosis. So for example, very often we see patients with MOXO test, so computer-assisted test, or MMPI test. And here you can see an excerpt from one of my patients who brought me the report, diagnostic report. where you can see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 tests that were performed, and this is typical. So this is one of the main psychiatric and psychology clinics in Poland, chains, you could say. They do all these tests, which costs really a lot of money. This is another chain of clinics in Poland, major chain of clinics, and they say that the basis for diagnosis of ADHD in adults is MMPI and MOXO test. So this is another problem. Of course, when these patients come to us and we explain that this is not the way to diagnose ADHD, they feel that there's something wrong with either us or those people before, but they couldn't get to those people that already did the test, so they try to argue with us that they already paid a lot of money for MMPI and MOXO, and they just want their diagnosis, which is quite hard to explain. Of course, we try to explain and propose other diagnosis method. Another reason for not diagnosing ADHD in Poland is low awareness leading to improper counseling. When I prepared for this lecture or presentation, I asked a psychologist, a colleague of mine, can you tell me what is the reason, what do you think is the reason why ADHD is not diagnosed from the point of view of a psychologist? And she wrote me a text message which I just translated, and I will read it to you. I think it's a matter of persistent myths about ADHD that reinforce the lack of need to improve their awareness. They're specialists. I mean, most psychologists and educators know about it, but treat it a bit like dysgraphia or dyslexia, a kind of learning disability, with a little bit of hyperactivity, impulsivity that causes behavioral problems. They feel like there's not much to learn about ADHD beyond that. It's not something that seems very relevant in terms of understanding someone's mental health or behavior. So it's only problems with grades in school, basically. At the hospital where I was working, the professor who was the head of the department also said that ADHD is only in school. So this is only a problem that causes problems at school. The same kind of information, of course, is passed to parents of children. So when children come to me at older age, and I ask them whether, or I ask their parents whether they were diagnosed and what they were told about ADHD, and they say, if he does well at school, then there's not much more of the treatment that we should do. I mean, there's nothing more to ADHD than that. The second group of problems is the cost connected with different elements. So, for example, diagnosis. I've already showed many tests that patients are often forced to do in order to get the diagnosis. According to updated European consensus on the diagnosis and treatment of adult ADHD, the diagnosis should contain, of course, careful collection of information from the patient, and this usually needs or leads to cooperation of a physician. In this case, I wrote a physician, but not always physician, but some kind of doctor with a psychologist. So usually this increases the cost of the diagnosis. And like I said, in Poland, very often patients are offered a battery of unnecessary tests that lead to nothing often. Then there's the cost of treatment. So in Poland, the medication is only reimbursed until the age of 18. So adults have to pay full price for the medication, and on the average it's around $70 per month, more or less. Not everyone can afford paying $70 a month each month. So this is usually and this is average cost. There are people who need to spend like $200 a month for the medication. Then another thing is that prescription is filled practically only by psychiatrists. There are some other physicians who do not resist or oppose to writing or filling the prescription for methylphenidate, because so far we only have methylphenidate from the stimulants. So the patient has to come to the psychiatrist, and then the prescription must be filled once every 3 months. So there's no such thing as a prescription for half a year, let's say. They have to come every 3 months to the doctor. All this makes the treatment quite costly. Then there's the problem of comorbidities. I think I take it from Kadra, maybe not, but anyhow, we know, when I show this slide, I say, don't look at the numbers, just remember that ADHD practically always lives with some other psychiatric problems, and usually 2 or more. And this is another problem, because those patients need to come to the doctor even more often to treat their anxiety, depression, or other problems, or addiction. So they have to come to the doctor even more often, and then they have to buy even more medication, not only stimulants. Then there's the negative perception by the specialists. Quite often my colleagues say that my patients only come to get something that will get them addicted. They want to get addicted, or they are already addicted. That's why they want amphetamines and methylphenidate. Or that they are lazy and they try to find some explanation for their laziness. And this is why they come to us and want to get treated. This is why my colleagues very often do not want to deal with those patients, because these are problematic patients, and also writing the prescription for stimulants is it's not so easy to write the prescription in Poland. This is a different kind of prescription, so not many doctors want to get involved in that. Of course, there's this problem of personality disorders that majority of ADHD patients have, and this poses quite often a problem during a consultation when, for example, the patient says that he will only accept this medication or not another, and all the different kinds of problems. But these are patients and we are doctors, and we should deal with that. There's also negative perception by the society. There was a study that children perceive the features of ADHD as negative features, and when they were asked whether they would like to associate or play with children with such features, they said no. And those of us who deal with children with ADHD, quite often, it happens quite often that when we tell the child that I think you have ADHD, the child says, oh, no, that's not possible. I'm not stupid. So children do not want to get diagnosed with ADHD, and they do not want to take the medication for ADHD, because, okay, as long as you say I have ADHD, I don't care. But if I have to take the pill, this means I admit I have ADHD because I take the pill. So around maybe 60% of patients in Poland, children in Poland, do not want to take the medication for ADHD, which is a result of all of that what I just said. And then at the end, there's another thing that media in Poland very often try to probably to get clicks or to get some attention, but write articles. Medication for ADHD will not improve concentration. It will get you addicted. And this is a major paper in Poland. And this, when people, general population, when they read this, they already know that surely no one should get medication for ADHD because they will get addicted, nothing else. Certainly will not improve concentration, as it says. It will only get you addicted. And from time to time, so this is, when did it happen? 2 weeks ago or 3 weeks ago, another major, maybe the biggest paper in Poland 1 year ago wrote a paper on, or article about how medication for ADHD is maybe not only, but mostly used by addicted people, and they only buy it to get addicted and not to get treated. So ADHD in Poland is poorly diagnosed and treated even worse. Low diagnosis rate in Poland is caused by low awareness among specialists, high costs of diagnosis and treatment, negative perception by the society. It is essential to lead awareness promoting activities among specialists and in the society, and this is what I'm trying to do all the time. Thank you.